Deployment of the vaccine has begun in many Indigenous and Northern communities throughout the provinces and territories. Every day, more people are getting vaccinated, and this is encouraging news. For instance, the government in Nunavut launched its immunization program on January 6th, starting with Josephine Adams, a resident of Iqaluit Elders Home. He was the first person in the territory to receive the Moderna vaccine. Vaccinations are also taking place in long-term care homes in Arviat, Johaven, Igloolik, and Cambridge Bay. Additionally, we foresee that by the end of March, Canada will have received enough doses of the Moderna vaccine to vaccinate 75% of the adult population in the territories. However, we recognize that First Nations, Inuit, and Métis have historically endured and continue to endure systemic racism and discrimination when seeking healthcare, resulting in mistrust in Canada's healthcare system. We also know that Indigenous peoples, regardless of where they live, experience a high burden of illness and are at a higher risk for COVID-19 complications. The logistics of a COVID-19 vaccine rollout are a complex undertaking and require coordination amongst partners in provinces and territories. An efficient and effective rollout requires co-planning and is dependent on full collaboration and partnership. We're actively participating in planning tables across the country led by provinces and territories and including Indigenous partners. We're also hosting a COVID-19 vaccine planning group with the national and regional First Nations, Inuit, and Métis partner provinces and territories, Indigenous health professions, and other federal departments. Our government is working with all provinces and territories to encourage full inclusion of Indigenous perspectives to ensure an integrated and coordinated approach to support the administration and planning processes of the COVID-19 vaccine for Indigenous peoples. While the vaccines have started to become more available in Canada, their rollout can't happen fast enough. As of January 12th, we are aware of 4,384 active cases of COVID-19 in First Nations communities on reserve, for a total of 11,502 confirmed cases since March. The numbers continue to rise, with over 800 confirmed COVID-19 cases on reserve over this past weekend. These numbers continue to be alarming and have now exceeded the national average and will continue to do so if gone unchecked. I can't stress enough the importance of following public health guidelines. Those measures are in place because they work. Despite the light at the end of the tunnel, the next few months will be difficult. It's important to follow the public health guidelines. Those measures work. They're in place because they work. Wash your hands, wear a mask, and when physical distancing is impossible, avoid gatherings. This saves lives. We see those measures work regularly. For example, in Squamish First Nations, Namgis Alert Bay, Attawapiskat, people have taken incredible steps to protect their peoples from outbreaks. Progress has also been observed over the course of the holidays in Shamattawa First Nation. As many know, last month, the armed forces were deployed to the community to support on-the-ground response to the outbreak. Thanks to their efforts and the determination of Chief and Council, the resurgence of COVID-19 was stabilized over the holidays, and the armed forces were able to leave the community. We've seen recent outbreaks in remote and isolated communities and recent increases in cases that are both alarming and concerning. We must anticipate and prepare for more in the coming weeks and months. As the COVID-19 pandemic increases in intensity, we continue to support First Nations, Inuit, and Métis to ensure that they have the tools and resources they need to keep their communities safe and respond to outbreaks of COVID-19. That is why today we are announcing an additional $1.2 billion in funding to support the ongoing public health response to COVID-19 in Indigenous communities. Providing communities with the flexibility needed to respond to COVID-19 is essential. Since the beginning of the pandemic, action has been taken at all levels to protect the most vulnerable and support those who need it most. Collective measures have been undertaken by community-based organizations across this country. This work is making a fundamental difference. That's why the Government of Canada is also announcing an additional $380 million for the Indigenous Community Support Fund. Finally, in recognition of the particular challenges faced in long-term care and home settings, we are announcing $186 million in funding to address specific needs in care centres to provide additional home care services in order to protect elders and other vulnerable community members. In total, Since March, over $4.2 billion has been announced in COVID-19 support to Indigenous communities and organizations.